Um, okay, well, let's begin. My name is Paul Collins, and I'm the Director of Youth Ministries over at West Market Street United Methodist Church, which is just a couple of blocks down the road. And I'm really honored and pleased to be moderating this panel with two amazing panelists. The title of this workshop, just so you know that you're in the right place, is Turning the Curve on Youth Smoking and Vaping. And so obviously there's a youth focus as well in this discussion. I'm joined by two amazing practitioners in the field. I have Kim Caldwell, who serves as a Tobacco Control Health Policy Coordinator in the Office of Chronic Disease Policy and Prevention at Mecklenburg County Public Health in Charlotte, North Carolina. Breath.
Yes.
A little more about Kim. Kim is enthusiastic about reducing chronic disease, expanding tobacco-free living, advancing racial equity, and developing others. Kim earned a Bachelor of Science in Biology at the University of North Carolina at Greensboro, and a Master's of Science in Public Health from Tulane University School of Public Health and Tropical Medicine. She's also completed the Duke UNC Tobacco Treatment Specialist Training Program, and she has served as a fellow with the Fanning Institute for Leadership Public Health Leadership Institute. Okay, it's a lot. Thank you for being with us, Kim.
Thank you.
And then closer to me is Natalie Thompson, and she is the Regional 5 Tobacco Prevention Manager, providing tobacco prevention, treatment, and policy support to 8 counties in North Carolina, including Durham. She also served as the Durham County Tobacco Health Educational Specialist and has worked in substance use disorder treatment, intervention, and harm reduction. Natalie received a Bachelor of Arts and a Master's of Public Health from UNC Chapel Hill. So thank you for being with us, Natalie. Let's just give these panelists a round of applause for being with us. They have a presentation which is going to be very interactive, so feel free to engage them with questions throughout, and they will indicate when it's appropriate to do so. I suppose also just feel free to raise your hands and ask questions. And then at the end, as we kind of wrap up, we can have a time for questions and discussion as well. So I'm going to hand it over to them. And I'm going to sit there in support of you all.
Thank you. Well, we have a small group today, but I'm glad because I want y'all to ask questions as we go through this material. Make comments. I like to have a conversation with folks when I'm talking about tobacco and these different topics. So the harms of commercial tobacco use today, obviously we're focusing on youth and young people. I just want to point out that we do say commercial tobacco, and that is because we want to recognize that there's a difference, particularly in North Carolina, between the sacred use of tobacco by many indigenous folks and the tobacco industry that has caused a lot of harm to us. So we're talking about commercial tobacco here, not the sacred use of tobacco by indigenous folks. So I want to ask you all, on a scale of 1 to 10, with 1 being not confident at all and 10 being an expert, how confident do you feel talking to young people about tobacco?
I feel very comfortable about talking.
7, okay. 7, that's pretty comfortable, yeah.
I'm a 10 than that. I really like talking about it.
You like talking about it.
Okay. Because I wasn't smoking.
Same. Yeah, and warning people about it. Yeah. That's good. I mean, y'all could be doing this presentation then, because I don't even know if I'm a 10. Because talking to young people is hard. I don't know about y'all, but it can be difficult.
I was a smoker for 40 years.
Wow. Ooh, you got me beat. Yeah, that's kudos to you. Congrats on.
You said you do what, ma'am? What do you do?
I am a regional tobacco prevention manager. So I work with different counties providing support with tobacco-free policies, programs, that sort of thing.
Videos,
Yeah, yeah, doing presentations, doing education, working with community agencies and organizations on tobacco-free policy or doing youth programming, all of that.
Does it keep you pretty busy?
What's that?
Does it keep you pretty busy?
Yeah. I mean, tobacco
Oh, yes.
in North Carolina, as you can imagine. Yeah, it does. Tobacco is a huge issue, and we're kind of going to get into that now because it's changing shape, right? The tobacco industry has changed shape now, and so we're looking at the new tobacco, which is e-cigarettes, right? Vaping. This is the new way that the tobacco industry has shifted its product landscape. To the point where I don't even try to keep up with it, y'all. I just, I let young people tell me what's on the market, but I just know that at its core that, we have issues with vaping and e-cigarettes, particularly among young people, because we're introducing chemicals into a developing brain, into a developing body that should not be there. And so that's really what I try to focus on when I'm talking to young people, rather than trying to keep up with all of this landscape and markets.
So you're asking them about how it's affecting the body, brain? Do they know?
A lot of times they don't, and I'm gonna talk kind of through that about the effects and how to talk to young people about that.
Thank you.
But that's a great question
I
because
think that's a great question to ask, and I want you to, as we go through the next 30 minutes of the presentation, I wonder if that will still be your question. Do they know? And
I was just wondering.
yeah, because there are so many different there are so many products on the market that are confusing. And in my part of the presentation, I'm going to use the word confusion as it relates to retailers. So we know if the retailers are confused, then young people are confused, and that's by design.
it is.
And but I would love to talk more about that too in the Q&A, as to what do they know, and do they think that this is a harmful product?
Yeah, that's why I'm
So I said, we have so many, like I said, we have so many out there. So you're going around talking to them or speaking with them about
Yeah.
it. So when you talk to them about it, so they wouldn't know which one, they're trying all different kinds, you wouldn't know which one is doing the effect, doing the most damage, or how the percentage
Right.
is doing.
Well, and that's really the reality of e-cigarettes right now, is that they haven't been around long enough for us to have long-term research studies the way we do with other tobacco products to say, this is what we know for sure about the harms, right? And so that's part of that confusion that Kim is talking about, that there'll be these claims that are made about these products being healthier or better than cigarettes. And in reality, that remains to be seen. We will have to find out in 10 or 20 years when we can get some human data about what these products cause long term. And that's part of the problem, right?
Damage be done by then. It's all about money.
Exactly. And I will definitely be talking about that too, because that is the main motivator driving this industry. So obviously, y'all know, if you've worked with young people, that we've seen a huge increase in e-cigarette use among young people. It's the number one tobacco product that young people are using. When I was coming up, it was cigarettes. We were all smoking cigarettes, but that is not the case anymore, right? Young people are vaping. And we've particularly seen, most recently, an uptick in the use of e-cigarettes among young people. So this is my first quiz question for y'all. Okay, so when you have an e-cigarette, every e-cigarette, it may look different, but it basically works the same way, right? It's got some kind of heating element. It's got a liquid in there that's heated and turned into an aerosol. So my question for y'all is, all of these listed are possible ingredients of vape juice or e-liquid, except which one? Which one is not a possible ingredient?
Which one is not
A possible ingredient of vape juice. So any one of these things could be in an e-cigarette, except what?
the water vapor?
Yes. I'm glad that you got that, because I get this presentation all the time and people do not get that right. And the reason why is because the industry likes to talk about, oh, it's completely safe. That's the reason why they call it vaping. They want you to think that it's water vapor, that it's completely harmless, but that is absolutely a misnomer, right? So any one of these flavors, propylene glycol, nicotine, are possible ingredients in an e-cigarette. Water vapor is not. So when we look at these ingredients, my next question for y'all, propylene glycol, nicotine, CBD, flavors, the ingredients that we find in vape juice, are these ingredients FDA approved?
No.
Now, let me tell you a story. After I had quit smoking and I was at an event back when this was still legal, there was a table that was set up and they had all of these fun flavors for you to try of vaping products. And there was a vendor there and they're like, all of the ingredients in these juices are FDA approved. They're completely safe. And I was like, okay. I mean, I was taken in, y'all. And this is before I worked in tobacco, right? So the reality is, surprisingly enough, that they are FDA approved. Now I'm going to explain how this works. They are the ingredients in vape juice, all of those flavors, all of those chemicals, propylene glycol, vegetable glycerin, they are all approved as food additives. They are FDA approved to put into your food. Okay? Now, what I know now to be true is that lungs are not stomachs, okay? So just because you can put something in my food does not mean it is then safe for me to heat it and inhale it into my body. So if y'all know about this, happened a couple of years back, the chemical diacetyl. It is a chemical that is commonly added to microwave popcorn. It makes it taste nice and buttery and delicious. It is perfectly safe to eat. But in the factory where microwave popcorn was being made, the factory workers were getting these terrible lung illnesses and it eventually became known as popcorn lung. Because diacetyl is a chemical that is perfectly safe to eat, but when you heat it and inhale it, it causes massive lung damage, right? So do not be taken in by the industry when they tell you that the ingredients in the vape juice is FDA approved. Because the reality is that when you're breathing in the aerosol from e-cigarettes, you're getting all of these chemicals, flavorings, nicotine, you're getting the ultrafine particles that are flaking off from the metal coil that's actually heating up that liquid, taken into your lungs. And that is not supposed to be there. And our lungs have no way of getting rid of these chemicals the way that our stomachs might, right? So when you eat something, you have a very efficient digestive system that's able to get rid of the things that may be toxic. But your lungs are not the same.
So that's just a backdoor way of putting it in there.
Exactly. And then they're able to sell it and make certain claims about this being a relatively harmless product. And so the next thing that I wanted to talk about is the fact that nicotine is in vaping products. So nicotine, if you know anything about tobacco, is the chemical in tobacco that makes it addictive, right? It is a highly addictive substance. And the nicotine in e-cigarettes can cause all kinds of issues, right? Because it is causing the person to become addicted to breathing in all of these chemicals that can cause damage to their lungs. The thing about the nicotine in e-cigarettes is that it's actually different from the nicotine in your traditional burning cigarettes. So another quiz for y'all. Which one of these has the most nicotine? Is it a pack of cigarettes, a disposable puff bar, which is one of those like little USB e-cigarette, or a jewel pod?
Puff bar.
I never heard of Jewel Pop, but it's disposable puff bar. Am I correct?
You are correct. So the disposable puff bar actually has the most nicotine in it. It has more than a pack of cigarettes, so does a jewel pod. And it's important to know this because in e-cigarettes today, they chemically change the nicotine to a salt-based nicotine. Now, I'm not going to get into the chemistry of all of that because I don't even know it. What I know is that it makes a type of nicotine that is more easy to inhale. It's not as harsh as the nicotine in tobacco. And so what we find is a higher level of addiction to e-cigarette products because of this salt-based nicotine. They're able to put more nicotine into it than you would get from a pack of cigarettes. And so that creates a higher level of addiction. Is that higher use, right? Yeah, absolutely. And so we see oftentimes that folks who use vape products or e-cigarettes that it is harder for them to quit those products than quitting cigarettes for that reason. Okay, next quiz question is, I hope y'all like cats because I like putting cats in my presentation. I'm sorry. Oh no.
I like cats.
I
love cats.
got 2 cats and 2 dogs. Okay. I'm gonna start adding more dog pictures because I gotta respect the dog people too. So our brains are developing until approximately what age?
Okay, let me see, our brains are still developing.
Yes.
What age?
25.
Yeah.
25 is typically when our brains are fully developed. That prefrontal cortex, the place that's responsible for thinking through the consequences of our actions. If you've ever worked with young people, you know that part of their brain has not developed yet. It is absolutely not there. And so tobacco companies know this, and they're very savvy in this landscape, in this day and age of marketing to young people. And these are just some examples of how they market vaping products in a way to make it seem like they are less harmful than cigarettes, but more importantly, that make them appealing and friendly to young people, right? So putting them in the same plaza as a Chuck E. Cheese, listing them along with food and snacks and groceries, and then making sure that people know that all ages are welcome. It's, these are subtle ways that young people can take in this information and think, oh, this is not that bad. And so other strategies that tobacco companies use with young people, and I'm gonna say, y'all, if y'all are watching shows on Netflix or streaming, I don't know if you've noticed, but I have, as a former smoker, there is an uptick in the amount of smoking that I see in TV shows and movies, because I will get triggered. I'll be like seeing it. I'll be like, wow, you're making me want a cigarette. And it is especially true for the shows that young people are watching, and the tobacco industry is responsible for this because they know that the more that young people see it, the more normalized it becomes, the more curious they become, the more they're going to be like, oh, that looks like a cool thing that I want to do. This is an example of an e-cigarette ad, and it shows these very young looking people holding vegetables. And so I ask y'all to think about this, because this is what I present when I talk to young people. I present things like this, and I ask, what is the message of this? It's selling an e-cigarette, but she's holding a carrot, or he's holding a carrot. What is that message?
That it's to be better to use the carrot than a cigarette, so you feel like you're holding a cigarette, but you're not really. That's the logic of that commercial, or whatever you want to call it. That's the logic.
It is.
You said a carrot or celery or something. If you feel like you have to have something.
Right, but they're selling an e-cigarette, right? So if they're basically saying that the e-cigarette is like a carrot. It's like a vegetable. It's like, that's too much for me. Like,
They're trying to make money. They're trying to get you hooked.
right, and
The
so
more you get on it, the more they sell.
exactly, and comparing e-cigarettes to vegetables they will never be in the same arena.
We in 2022.
Exactly. And also reflecting on, if it was true that you were marketing the e-cigarette products to people who smoke, if that is true, take a look at these folks. Take a look at their demographics. This is not the demographics of folks who smoke, right? Because typically we see the highest rates of smoking among middle-aged folks, right? Among folks who are lower income. Like, this does not look like that they're appealing to that demographic, right? Okay, so this is kind of just a summary of the public health concerns that we see with e-cigarettes. Obviously, they're appealing to youth. They're introducing a nicotine product to a developing brain. And oftentimes what we see with young people who try e-cigarettes is that it makes smoking seem less harmful to them, right? They're already using a nicotine product. They're doing this motion. And so graduating to smoking is something that is more likely to happen. Renormalization of smoking. And then I also just want to say it often can delay, for folks that quit smoking and then pick up an e-cigarette, it can delay them quitting, and oftentimes it's harder for them to get off the e-cigarette than it was for them to quit cigarettes. Okay, and then the last thing I want to touch on is how to talk about this with young people. So what do you all think is a recommended way of talking with young people about tobacco or about vaping? Is it asking them what they know? Is it connecting by recounting stories of your own experimentation? Or is it waiting for them to bring it up? What do you all think?
So that was one of my questions about when should you start presenting to your youth
Yep.
about how you gonna present first
Yep.
to them.
We're gonna talk about it.
I have to do like,
I'm just gonna shut up.
No, I appreciate it because you're like setting me up at every
No,
turn.
this
You're
is
like the
good.
perfect, yeah.
I think she has a copy
Like,
of the presentation.
I know. Next time you can give it though. What do you all think?
I was asked, the first question I was asked was ask them what they know or what they see.
Yes,
Yes.
absolutely.
You know, because I don't think they know what they see. They just get it because
The friends, the
Yes,
friends,
yes.
That's the thing to do.
and
They
they
do.
just speak.
Yeah.
They
Yeah.
smoke it and they think they're really out there. They think they're cute and it's not cute.
It is, and I definitely think that, asking a young person is often the first thing that you can do. And I think starting as young as elementary school, because, we want to talk to them about what they're seeing before they start experimenting. One of the things that I like to do is really talk to young people about how tobacco companies manipulate them. Because oftentimes tobacco use, e-cigarette use, smoking is considered this like cool, rebellious thing. But in reality, they're just participating in being manipulated by a company that wants their money. And I like to tell young people that because they, oftentimes they don't want that. They don't, they're manipulated by their parents and controlled by everybody. It's like, do you want to be controlled by this company that's trying to get your money? And I also asking them about what they know, what they see, because if I try to present on these are the products on the market, young people laugh at me like, oh, that was so last year. And so really asking them, what are the messages that they're getting? What are the products that are on the market? What are their questions? And what they have heard so that I can correct whatever misconceptions they might have. Making sure that I let young people know that nicotine is a harmful substance to their developing brain. Regardless of what adults do with their life and their brains, at the end of the day, your brain is not fully developed. And do you really want to compromise that development? And then lastly, as a former smoker, former tobacco user, I like to be honest with folks, right, about my experience. And I want to be careful that I don't glamorize or minimize the struggle that I had to go through, right? Because you don't want someone thinking like, well, I'm going to be just like her and like smoke for X number of years and then just like drop it once it stops being cool, because that is not the case for most people. And so making sure, if I'm going to be honest about my experience, that I am truly honest and that I don't glamorize experimentation. And that goes for drugs and alcohol as well, because a lot of times when folks are talking about their experience with drugs and alcohol and experimentation, and I used to work with college students, this happened a lot, it becomes an enticing thing, right? It becomes like a funny story, and you don't want a young person to just walk away thinking that they can try something and mess around with something without knowing the real consequences of it.
That's right.
All right.
Yeah. Sorry, I'm gonna have a question.
Go ahead.
Oh, yeah.
There are a couple, really.
So one of the things I was thinking about, so that slide you said, talk about it. All right, so Partners in Health and Wholeness, co-director for this program. One of the things we did was put out a survey asking some of the churches and faith communities, what do you know about like the young people in your church and smoking or vaping? We asked about smoking, then we asked about vaping to separate the two.
Nice.
And over 60% of them were like, I don't know if any of the young people in my church vape. I don't know if they know about vaping. I was like, I was thinking, they know about vaping. But you don't know about vaping and know to talk about it, right? So I think one of my questions is, so for us, right, we're thinking about starting from all this place back here about talking about what is vaping, why is it dangerous, what does it look like, and yes, your young people are being exposed to vaping. So that part, like if y'all have any tips for that. And then the second part is, where did we lose the messaging? Because this feels like going back to talking about the dangers of cigarettes. Because it's not like we don't know that nicotine is dangerous. So how is it that we lost the messaging of talking about, why are we having to say nicotine is bad for your brain? Just because it's packaged differently, like that just gets me, right? Because it's not just that it was cigarettes and tobacco, it's the nicotine. And now we're all the way back here again, talking about something that I thought was kind of established in a way, but apparently not, right? I don't know. So that's kind of where.
I can't understand.
I have a couple of responses to that. So I work with 5 different populations, or sometimes I call them 5 projects, depending on what space I'm in. So that's youth and young adults, Black, African American, faith-based organizations, LGBTQ, and behavioral health. Those 5 different spaces, the tobacco industry is marketing to you very differently, and they want all young people across the board in all of those areas. And so with my faith base, I work closely with our Village Heartbeat program in Charlotte. And so that's with a pool of different churches that come together to work on reducing chronic disease. So that fits very nicely in what I do for public health. So any organization that's interested in reducing chronic disease, I'm like, let me come talk to you. I do struggle with the conversation with my clergy and some of my seniors about tobacco, and I'm gonna tell you why. In the Black community, think about your house. Your rules are these are my rules, and they better not break my rules, and they better not bring tobacco or a cigarette to my house. So they've already shut the young person out because these are my rules. So when you've shut that out, then you're not open to learning about these new products. So that's just what I've actually witnessed with my groups that I work with, just in the faith base. The second part of that is in about 2013, we lost a lot of funding in the state of North Carolina for prevention, tobacco prevention. So that money was like in the multi-millions, and it went to 0. So when the state decides that we're going to shift the funding, and I'm not trying to talk politics here, but this is just the facts, when they had to shift the money to other areas in healthcare and across the state, we lost momentum here in the state of North Carolina and some of the other states. So that's 2013. And then Juul came on the market in 2015.
Right.
So they had enough time to say, we're going to market heavily here because we know that North Carolina, as well as other states, took that money down to 0, little money for prevention.
Right.
And so that allows these other companies to rise up. And so the first company was Juul, and then others
All the other ones.
under that. So we are making up for some lost ground, just from the 2013, 2015. And then we did lose a couple of years because of the pandemic, the COVID-19 pandemic. So I say that, however, our Attorney General here in North Carolina was the first Attorney General to sue Juul Labs.
Right.
And then we had other Attorney Generals to follow suit. So had he not done that, we wouldn't be in a very good position right now in North Carolina. So we're receiving $40 million over the next 7 years that will go towards prevention and hopefully increase our workforce in what we do. So I hate that we had that happen where we lost the money. But we do know that this is going to be helpful, and it's going to hopefully re-normalize healthcare in a way to be well. And that's what most of us are transitioning to, is this holistic approach to healthcare, as opposed to saying these are the only ways to be healthy, but more of a holistic and meeting people where they are, which means you have to meet young people where they are. And even if you don't know what the products are, you can just say, hey, what do you know about tobacco? And something that they say will spark you to start investigating those words. Natalie just mentioned, like, her focus is, I just want to focus on telling them about the harms and also protecting the brain, because it is difficult keeping up with marketing. But one of my favorite topics is talking about marketing and policy. I can talk to you for like hours. I actually study the marketing. Everybody in this room, we're already aged out. The tobacco industry no longer wants us. And do you know why? Do you know why? What are 2 things? We want 2 reasons why they don't want us.
I didn't know what to say,
What are like 2 reasons? There's multiple reasons. So what are some reasons why
we
it's
experience, we know the difference now, as an adult, older adult. No, older adults don't know the same thing. I'm just saying.
Some of our brands are
It
still
is, it is. So maybe in maybe that one respect, because when you see what's going on, because we've been here longer, and we're going through all this, we're gonna see when it started, how it's going. So maybe we're doing that, and I kind of push it. Now, when you saying about the 40 million, the next 70%, so that hopefully, like you said, I know you need more, put more people in the market to help with trying with prevention and all that stuff. So does that go toward, when Jules come up with all this stuff, and trust me, there's somebody sitting there trying to think of another way, try to market something for the youth. So will that be included that $40 million to stay on top of that, or what? I know you don't think we're talking too much.
No.
No, so I think that's a very good question. So the first part of that, so when you get to be a certain age, you kind of start to have, health issues sometimes. So you're focused on improving your health. That's one thing. We have more bills now. You have mortgage, you have rent, you have car, you have insurance, you have all these things. So your money is going, the money you have left is going towards like the things you really want to experience. Traveling, or for me, buying that yoga mat. I don't know why do I need another yoga mat? I have 6 of them. That's a problem. It's just me. So you don't have a lot of money, whereas a young person, they can go work a 4-hour part-time job and they feel like they have a lot of money. And so they are buying things that really don't matter. It's disposable. Clothing, we do want them to buy clothes, right? But we don't want them to buy jewels and things like that. So I've worked with a lot of young people that actually have helped me do better in this space. So now I do encourage them to go buy that shirt that you want, because I'd rather for them to buy the shirt than to buy the jewel, or a Puff Bar or an Elf Bar. And I know I'm naming all these products that you may not know about, but I would rather it's a trade-off when I'm working with young people.
Yeah.
And I'm sure you see that too. You're working with them, there's trade-offs, and you really want to get them to start thinking through, if I'm faced with this decision, how do I make the best decision right now? Okay? In terms of the money, I don't know. I just know the last 2 years, Jewel can say we've done enough, and maybe we won't get the last 2 years of funding, but that's just about as much as I know.
So I think your question kind of speaks to a larger issue with the industry, in that they're always one step ahead. And in some ways, the way that I reckon with that is like, we will never have as much money as they do, even with this $40 billion. And so, to some degree, I don't know that we can necessarily keep up, but I want them to know that we're watching them, and that their actions will have consequences. Like, we may not be able to stay one step ahead of y'all, but we're right behind you. Don't forget. Rather than just give up on the problem, right?
Yeah, and actually your question does lead towards the second half of the presentation where we're talking about policy. That's my favorite thing. That's what actually most of the majority of my work is around policies. So I write policies with organizations to protect us from secondhand smoke exposure. That's what I'm passionate about. I was not a tobacco user, and I didn't come from a family that uses tobacco. And Natalie and I have these great dialogues, which is why we partner well together. And I was just telling her at lunch that it's hard for me to participate in society because I have to ask so many questions. I was just talking about going to a restaurant, and I have to ask, are we going to sit indoors or outdoors? If we're outdoors, I'm like freezing up, like I don't want to be exposed. If I get exposed, I'm going to have an asthma attack. If I have an asthma attack, I have to take out the inhaler. If I have to take out the inhaler, it's creating anxiety. So it's not really fun for me to participate in areas or spaces that I'm not sure have a full comprehensive tobacco-free policy. On my way here, I saw signs on buildings that said this is a smoke-free community. That's great. However, just like that says smoke-free policies, I go for the golden carrot, which is tobacco-free. I jump over smoke-free because that's not enough for me to participate. So I would love to be able to see a country that is tobacco free, but because the industry also knows there's people like me, they're already working on products that are labeled tobacco free. And we don't have that in the presentation today, but that is also what causes confusion with our retailers and our young people. So I have to be mindful that even though that's what I want for a long-term strategy, they are already light years ahead and working on products that are synthetic nicotine, tobacco-free products. But those are very good questions. So in a real world, like as of today, we know what works, and if there was a vaccine, those 4 things on the left would be in the vaccine, and that will equal perfection. And that's increasing the price on tobacco products. That is actually increasing the tax on products. That's actually, and this says smoke-free policies, and this slide is from the Office of Smoking and Health, which is at the CDC. However, I rewrite this slide and I put tobacco-free on there because that's really going for the golden carrot. At the local level, I can write policies that protect everyone in Mecklenburg County. I cannot write a policy or a law that's stricter than the state policy or state law because we have preemption here in North Carolina, which basically means local governments do not have the authority to write something higher than state governments. It can allow for a little bit of confusion if you go from county to county and you may not know the county law as it relates to tobacco. But one of the things that 2 areas that are 3 out of the 4 that I do are I create policies, I write campaigns, or I create them from scratch and implement them, or I may pull a campaign off the shelf somewhere and implement that in our area. And then cessation, the new word for that is to think of it as nicotine dependence treatment or just treatment. Okay, so making sure that treatment is available for everyone. And I lead through the space of equity, so treatment is going to look different depending on who I'm talking to. Everything on the right-hand side is tricky, and we're going to talk about that.
Now, your hard-hitting media campaigns, that's what you do mostly.
Yes, I have written 2 campaigns in the last 4 years, and I'm on my 3rd one right now. So my first one was working with a youth group in Charlotte, and I asked the young people if we had to come up with a campaign, what would it be? And I just did a presentation like this. They created it from scratch, and that campaign is called Too Woke to Smoke, and we launched it at CIAA in 2019, I believe. Yeah, and it was.
So I was wondering how you got it after you got it all together.
Yeah, so you create things that are fun, but always bring youth in.
Into the.
You want to know why? Because we've already been young before.
Yeah.
We're not young anymore. So our brains they're so far removed. So you always want to bring youth into the space to create fun and excitement. And if you want them to listen to you, then they get to talk. The second one I did was last spring because we had money left over from we had the pandemic. So the budget that I had for the year, I needed to use those dollars somewhere else. So I had the world's smallest budget, which was $3,500. And if you've ever done a campaign, you can't do a campaign for $3,500. Actually, I've done 4 campaigns. But that one's $3,500. We ran it for 6 weeks. We partnered with National Cinema Media, and we exceeded all of our goals. And so we exceeded our impression goal by 5%, and then number of clicks by 22%. And so that campaign was designed just for young people, and it was prevention. So I was able to do that, and now we have a campaign that we're working with another organization, and that budget is $180,000, and we hope to get a year's worth of a campaign. It's going to be social media as well. So since we're not in the office every day, and we don't have to use our budget for like food and meetings, in-person meetings, I'm using it and taking it to social media, because that's where the young people are. So I'm somewhat capitalizing on the pandemic as well. I offer cessation treatment. Natalie and I both are tobacco treatment specialists, so we offer treatment in the form of counseling with individuals or groups, and we can talk a little bit more about what that looks like too. So those are three things that are really in our control at the local level. I cannot cause a price increase. I can advocate. That's one of the reasons why we're here, because we want you all to learn more about how you can advocate for a price increase. What else do we want you to advocate for? Age of sale. We're going to talk a lot about that. Age of sale. 21. We want you to be 21. Oh, I just gave you the answer.
Oh no, what
Oh, wait, no, I
percentage?
didn't.
Yeah, what percentage of
No, I
people
didn't.
start using tobacco?
So what percent of young people start using tobacco before the age of 21?
Ooh, you mean for today now, back then, when, now?
So the percentage of people who currently use tobacco, what percentage of them started before they were 21?
It really doesn't matter if you chose 20 years ago or today.
Yeah, it's
Obviously, wouldn't make men it be 21.
I say,
Men it be 21.
What
That was
percent?
18.
What percent of them start before the age of 21?
I can say the same, for your age wrong.
What do you think? You work with young people.
Yes, but
They just may not tell you.
What's that?
They may not tell you.
Right, yeah. I don't know.
age wise,
50.
but I don't know.
Okay, what do you think?
I think higher, 60, 65.
Okay,
Yeah.
all right. Anyone?
No.
I know y'all are trying to team up and figure this out. Okay, well, since you don't know,
No.
what if I told you? Oh wait, I think I just turned this off. Okay. 95% start before the age of 21.
Yeah.
Yes. And that's why I said it doesn't matter if you chose 10, 20 years ago, because
Yeah.
that number is still very much the same as it is today. Yeah.
For all the same factors that we were saying earlier, right? Like brain not fully developed, vulnerable marketing population, access to disposable income, all everything's pretty much the
Tobacco
same.
industry targets, yeah.
Yes.
Wow.
Absolutely.
So
And when I'm doing, when I'm doing group counseling, most
Yeah.
of my counseling is with seniors.
Okay. Wow.
And so I lead with empathy, because when I share something like this data, it resets them to that time period. And I'm not a counselor, so I don't want to bring them back to a period of trauma. But we also know that individuals start using these products because something traumatic happened. Maybe it was done to them, or they experienced or witnessed trauma. So it's never your fault. If you started using these products at 10, 11, 12 years old, your brain is not fully developed. You are supposed to be under the care of a trusting, loving family or parent or guardian, and something happened to you. So I always say it's never your fault. And even if someone starts at 18, 19 years old, it still isn't their fault. They're still learning, they're growing. We all were 18 at some point, and we made mistakes. So just kind of come through a place of empathy. Now, this document is written by the Surgeon General. If you need a book and something to hold your door open, it's that thick. But it talks about we all own a copy of this. But this talks about the health consequences of smoking over the last 50 years. So that focuses on the word smoking, okay? It didn't say tobacco, but smoking. Smoking is combustible, anything you set on fire. So I mentioned everything on the right-hand side of that first slide is tricky. So this is the map of the United States, and it says tobacco 21. It had the word 18 in there, and it's scratched out. So you may hear me say, or now they say T21. And what that means is we are interested here in North Carolina of increasing the buying age to the age of 21 to match the federal legal age of 21. So the prior administration in December 2019 was like, we really need to get behind improving the health of young people. Because Juul had really taken off, and the Congress and the Senate had a lot of pressure on them. So in December 2019, while we were having fun at the holiday, they were working, and they increased the buying age to 21 at a federal level. There's only 41 states, I believe, that actually have the law match the federal level. North Carolina, South Carolina, we still have age 18. However, you're going to say, but Kim, I was just at, She gave me 5 minutes. So overall, what we want you to know is that we are looking at ways to increase the federal level, match the federal level. That takes time. You can't just write a policy and say, okay, you must be 21. Okay, and when you write policy, you understand you have to think about enforcement, who's going to be impacted by this, and how does this benefit those who do not use tobacco. So what we do know is this is going to help young people lose that source that they originally had. So if I was 18 years old and I could go into the store and buy it, I could buy it. If I was 17 years old, I can buy from the 18-year-old seller at the high school, but now I don't have access to the source. If I'm 20 years old and I'm on a college campus, I still don't have access to my traditional source, but as a 20-year-old, I know 21-year-olds who can still buy for me. What we're trying to do is get you closer to protecting your brain for a few more years, okay? So I'm just gonna run through the next couple of slides because I'm going to reiterate this slide. However, what I want you to get from this is we don't have a license or a tobacco permitting system here in North Carolina. So if there was a system, think of like there are ABC stores. There is a system. Every store that sells alcohol in North Carolina has to be in alignment with the ABC board. There isn't one for tobacco retailers. So anyone can just really buy and sell, set up shop. If I wanted to look up a name of a retailer and try to find them, I couldn't find them. And that's problematic. The other thing that's problematic, I mentioned earlier when I said you're going to hear me say the word confusion. It is confusing to retailers that this person has to be 21 to buy alcohol, but they can be 18 to buy cigarettes. That needs to match. If you think about, if you've ever worked in retail, you're really fast. Everything's fast paced and you're trying to get people in and out. So some of our retailers have made mistakes and sold to youth who are underage. So we want that to match. So when ALE, alcohol law enforcement, is going in to do inspections, then retailers are not getting penalized. And we also want to have responsible retail practices. So that's at the store level, that's also state level. So what are some things that you can do now? So it sounds like you all are engaging with youth. We all know we're here for the reason we're here at this beautiful church. There are some resources that are on the CDC's website. People like me read them. I'm not expecting y'all to read them. People like Natalie read them cover to cover. We read them because there's some best practices and evidence-based strategies that we are just like, I need to learn something else. Or that strategy I was using may not be effective for the audience that I'm working with right now. So I just listed a few that are available. However, on the CDC's website, there's 10 or 15 more. Youth engagement, you're all working with youth. Health equity, I would strongly encourage you learn a little bit more about health equity and how to make sure that happens. Partnerships, you already know how to do that. You probably already have different task forces and coalitions. Just give me 1 minute. Yeah, so that's what I'll say. But in 1 minute, I'll tell you, in North Carolina, we have the lowest tax in the country. We are at 45 cents on a pack of cigarettes. We do tax e-liquids here for electronic cigarettes, and we tax them at 0.05 cents per milliliter. There are some states that do not tax. If we could increase the tax, increase that price there, it answers a little bit about your question. If we can increase those prices, that money can go into prevention. Only if the state asks for it to go into prevention, but it's probably going to general funds. Menthol. I'm going to just go all the way to the end here and leave it here because those menthol slides, the reason why we have menthol in there is because it is the only flavor that's still allowed to be legally sold in the United States in cigarettes. It is a flavor. It is a minty flavor, and as one of my mentors says, Dr. Philip Gardner, it allows for the poison to go down easier. And so when you mask a chemical such as nicotine, then young people that do not taste the nicotine or the chemicals first, they taste the mint when you're experimenting, and the next thing you know, you've moved into a daily user and you're addicted. We know that we have seniors that we're working with that are started with menthols, and 3/4 of Black people who start using cigarettes start with a menthol.
Yes.
Okay, and we know that anyone that identifies in the LGBTQ community also is using menthols at higher rates than other populations. The data really points into those two groups. So that's why we have this reiterated a second time that raising the age is also going to protect our historically marginalized populations, it's going to protect the growing brain, and also gets the high schooler all the way through high school without some of those distractions. So those are some things that I really want to enforce around menthol,
Repeat that about the menthol. Did you say they were not good for the menthol is less harmful, or you saying it's more harmful? The menthol cigarettes.
menthol is a flavor, so it's
Yeah,
a flavor.
because I started on menthol myself, and that's when I started, and I kept doing on menthol the whole time until I stopped. You know, so I'm just wondering about the menthol. What did you say about that?
Well, it is a flavor,
Yes.
and so it is the only flavor that's legally sold in the U.S. And so that's an issue itself. It's like, why were all the other flavors removed?
It's more
out of
addictive, you
cigarette?
say, than menthol.
It is very addictive. Menthol is
That's
very
what I thought you said.
yes. And so we could remove menthol, which is one of the slides indicated. There's a conversation going on at the FDA around menthol. And there's two things that we're asking for from everyone that's doing this kind of work. One, remove menthol, ban it. Ban menthol, remove it. The other thing is removing all characterizing flavors in cigars. And so think about Swisher's Sweets. What's some of those brands that you make?
Black and Mild.
Black and Mild. Have you heard of Black and Mild?
Yes,
Yeah, Black
I
and
hear
Mild.
that a lot. They buy them a lot.
And look, my husband just quit smoking them a year ago. He's 30-year truck driver.
Oh,
And that's all he smoked.
Yeah.
Good
Good for him.
I hear that all the time, but I don't know much about cigarettes when I
Yeah.
start
They're real
smoking.
popular.
Yeah.
They're really popular. They're very inexpensive.
It's a cigarette? Is it a
It's
cigarette?
like
Yeah.
It's a cigar. It's a
The cigar.
It's a
Oh,
cigar.
I see.
It's
Okay.
like 5 in a pack, yeah.
Yeah, it's a
Five in a
cigar.
pack.
5 in a pack.
Oh my God.
It's just, well.
So you may also hear the word little cigar.
Yeah.
So there's little cigars, and then you have the big Cuban cigars. So little cigars are very, very cheap. You can get 2 for $1, you can get 1 for $1, but think about it, young people can get their hands on $1.
Yeah.
Yes.
And I'm only talking about tobacco. We didn't even talk about any other substance that people put inside of the little cigars. But maybe if we can come back in the future, we can touch on.
Yes, I had a question I wanted to ask about cigarettes, period, but you didn't get there.
About what?
Cigarettes, period.
What's
I wanted to ask some questions about cigarettes, period. I don't know if it's in your field or what, but we wanted to know how long, once you start smoking and you stop, how long does it take before it leaves your system?
Okay, can't grant it.
Oh, leave your system. So you mean like if you decided to quit today?
Yes.
When do you see benefits in your health?
Right.
2 weeks. This is the minimum amount of time.
What'd you say?
2
2
weeks.
2 weeks?
You'll start to be able, like your blood will start to self-regulate. Your breathing will be impacted for at least 2 to 3 months. So you're gonna get the nagging cough.
Yes.
So on the application, when they ask you about, I know that right now. When they ask you about. On the application, they ask you about how long you used to smoke and you got it 10 years ago, what does it matter?
Oh, I see what you're saying. Like when you go to the doctor. Got it. You know what? That's funny because
Well,
I was just in conversation
yes.
with some medical professionals about
Yes,
that question.
yes.
So the reason that's there is because it does take years for your body to be somewhat clear to be what would be pre-tobacco user. Does that make sense? So it takes years to kind of reset the body.
I was just wondering how many years, I just wondered, is that just something that lingers, or just after certain years it stops, or?
I would
I
say
mean,
that.
you know, I know it affects your lung tissue.
Yes.
And I also have a question on
Doctor,
doctor.
and nurse, so
And
that's.
I'm just, I can tell all that.
That's
I'm gonna
right.
answer it this way, you said you're a nurse, right?
Yeah.
So think about when you are working with someone that's pre-diabetic
Right.
and they're a tobacco user, which one of those topics do you tend to lean on first as a conversation?
I used to lean on it when the opportunity arose. You know, when it just came to me, and if I had to deal with it then and try to do it in an effective way, that's what I dealt with. It wasn't, you know, what I chose to do, and just whatever which one come up first. And then I went all out trying to figure out, trying to answer what was it with the doctors because I can't diagnose. But, you know, that's what I did. So, I don't know, because both of them are so important. I really didn't put a percentage on one or the other, because both of them are so important. And I also think about the alcohol and the people that are there with.
Yes.
You know, people, but, you know, we live in a country, you know, and they're, you know, people drink all the time. But they don't seem like they're trying to put a ban on alcohol. And people drink all the time.
Well, that's true. There's definitely an uptake in alcohol use. That's a whole other conversation. I would say.
What's a cigarette? You know, like I said, if we, you know, we talk to them about, you know, as far as preventing measures.
Yeah.
But if they come in and say, I'm glad I get out of here because, you know, you can smoke now. And, you know, and I said, well, you can, but just think about it, get your lungs before you release it for that. You know, or have a long in the hospital. Then if you want to go out, but for a lot of people, like I said, it's a deep issue. Because a lot of people have issues, and that's one of the stress for them is smoking.
Yeah,
And they do
but
it.
it impacts the other organs.
Yes.
And so if I went to the doctor for my regular checkup, they're not looking at all of my organs,
That's right.
right? But when I do blood work, something like may arise where it's like, oh, why are the levels low, high, whatever that is. And so it does take a little time to discover and ask those probing questions. So I know Natalie wants to respond to that too, but that.
Well, one day I'm gonna, you know, that's just what I said, you know, I'm just gonna watch it, like I said, I know it affects your lung tissue. But I also wonder, like I said, I'm kind of asking about that here. And does it also affect your bronchioles?
Oh, yes.
Does
It affects
Smoking causes diabetes.
Yes.
So if someone's pre-diabetic, smoking will cause them to have diabetes.
Yeah, that's why I asked about
Yes.
diabetes. Which one would you
Yes.
tend to lean on?
You know, because I used to be smoking after that age.
That's the 20 years and I'm not a diabetic. Thank you.
So before we go, I just want to give you all a round of applause.
Yeah.